Hi, everyone. Welcome back to our series, Overcoming Physician Burnout, the Journey of the Health Architect. Now, last time we began our discussion by talking about how physicians today are surrounded by different pressures, whether it's medical information overload to the need to be financially savvy in the workplace. We saw how these pressures have forced them into a chasm of moral injury and burnout. So let's pick up the thread from there. How has the physician community responded so far? Well, on the one hand, unfortunately, many physicians have felt that the only way forward is to leave the practice of medicine itself. We saw this during the COVID pandemic and its aftermath as part of what was called the Great Resignation that affected other industries. And in healthcare, we saw how healthcare professionals, including physicians, either retired early or moved to non-clinical work. On the other end of the spectrum, we have physicians who today feel like, you know what, these pressures are just the normal expectation for physicians. And they have to just grin and bear the stress of what that brings. As they do so, they have to push their emotions down. And, honestly, they suffer silently because we know that the prevalence of mental health issues is not low in the healthcare professional and even physician cohort. And that has led in some cases to really dire consequences, including suicide. And then finally, we have physicians kind of in the middle. They tolerate the system up to a point, but then they complain. And all the while, they're hoping and expecting that the system is going to have this aha moment where they're going to change things and make things right so that medicine can be practiced the way it always was meant to be. Now, I don't think any of these is actually working out very well. And one reason I think so is that half of the physician workforce is still burned out. You're going to hear about in this series that there is a different way. I would argue a better way. And that way is the way of the health architect. Health architects meet the system proactively rather than reactively. Health architects regain balance while they're doing clinical work, not just when they're trying to cope with what happened during the workday at the clinic or at the hospital bedside. Health architects recapture some of the excitement that took them to study medicine in the first place. Now, to be clear, this is not about putting more onto your plate in addition to what you already do. Health architects look at clinical work and reorient and re-strategize their approach in a more mindful and effective way. Now, you may be wondering, okay, that's all well and good, but is this even possible? And I would answer that the answer is yes. And the reason I say that is because that's exactly what happened to me. I spent a decade after I finished training moving from position to position around the country and facing conflict after conflict until finally I hit rock bottom and I had to face a crucial decision, whether to leave the practice of medicine entirely or to fundamentally restructure my approach to clinical work. Now, I elected the latter, and my path forward has been how I've evolved into being a health architect. In my journey towards being a health architect, I realized that there are two things that were fundamentally missing from my clinical work. First was a sense of agency and control because I just felt out of control. I wanted to do certain things in the way that I've been taught, but I couldn't do it. And all the while, people were telling me to do things in a different way. You will hear in this series various bases of knowledge as well as skill sets that I gained and hopefully will help you to pull back some of that control into your hands. In addition to that, what I felt like I'd lost was a sense of human connection with those around me. I felt lost, I felt alone, I felt isolated. But with new knowledge bases and skill sets that you'll also hear about in this series, I was able to bring more of that connection back. And I felt more bonded and connected with various people around me, whether it was my patients and their families, but also with the healthcare professionals with whom I worked, including administrators. Now, the first step to becoming a health architect is to understand that we need to make an oath. We're used to making oaths throughout our lives. We make oaths as family members and friends, as parents, as spouses. We also make an oath to our communities as law-abiding citizens. And even within our profession of medicine, we have all followed the teachings of Hippocrates with his oath to do no harm. And that still resonates today. And we can see medical students taking on some version of that oath even today. But with today's pressures, we need more. In fact, we need a series of oaths. We need to make an oath to understanding how to differentiate between medical fact and fiction. We need to make an oath to understanding medical technologies and know how and where to apply them. We need to make an oath to understanding what I call the horizontal and vertical structures in healthcare to allow patients to successfully navigate this maze between care locations and understand who are all the different people that will interact with them in healthcare delivery and lead those teams. We need to make an oath to understand how we as physicians can optimize the financial viability of the very clinical programs we serve. Now, central to these oaths is one crucial one, and that is to the health and wellness of everyone, but not just our patients and their families, but ourselves. Our health and wellness as physicians matters. And in this series, you'll hear about how we can bring that back, how we can bring back the sense of agency and human connection that lie at the core of trying to move forward and bring purpose and meaning back to our sacred profession. Now, having an oath is a great first step, but that's an abstract and conceptual idea. We need to have something that's more practical. We need to have something that we can use on a daily basis while we're in the workplace and trying to get through the daily grind. And you'll hear about that in our next segment. So we'll hope you see you then.